I'm Sheldon Seidel. I'm with the Committee on Conventions, and I'm also your moderator for this morning. If you have any comments or if we've served you well, let us know. If we have not, let us know. This meeting is for you. Usually the cliche when you introduce a speaker is my speaker needs no introduction, but I think everybody here has a relationship with Dr. Weiss and knows all about him. So I'm gonna just let him take over. But I can see that he's well regarded and well loved, and so I give you the floor, sir.
Well, good morning. I know all these guys. I don't know all you, but welcome. Thanks for coming out this morning. I'm here to cover a topic that I'm very passionate about because I feel strongly that having a mentor or a career coach in your corner, helping you with the very many important decisions you're going to make both in your personal and professional career to be invaluable. When we kind of start off in life, pretty much through residency, there's a natural pool of mentors surrounding us, starting with our parents, an older sibling, maybe a friend. You've got your teachers, you have your faculty, and you have your co-residents. And then you leave residency, and at a point that I think you need one the most, that natural pool of mentors kind of decreases. And this is at a time when you're making some important decisions, like what kind of practice do you want to work in? Do you want to be in corporate? Maybe you'll be in a private practice. Or maybe you want to open your own practice. And then there's decisions that you have to make with regards to signing an employment agreement. And that has a big impact on your relationship with that employer. It's a very important document. And then, just as important, making sure you're working on your work-life balance. That has to be done intentionally, not by chance. And our previous lecture was on burnout. And I believe that making sure you have a good work-life balance can significantly reduce that risk of burnout. So my goals this morning are, number one, to give you many reasons why you should consider bringing a mentor into your life. And more importantly, I'm going to try to motivate you to go out and find one. So a little bit about myself. I did my dental school training at Temple University School of Dentistry, graduated in 1988, went on to a 2-year certificate program of orthodontics at the University of Medicine and Dentistry of New Jersey, which is now called Rutgers. So if you do the quick math, you can see I've been in this profession for 34 years. And I started with one practice. I came out of residency, and it was very commonplace when I came out of residency to buy a practice out of residency, and so I bought a single practice, a sole practitioner, who had himself been in practice for about 30 years. And over the years, I'm now at 9 orthodontic pediatric dental practices. And actually, number 10 would have been that first practice that I bought. It was the only practice in my portfolio of practices that did not have a direct pediatric dental practice link. And so I did sell that one in 2018. And during my discussion today, I will explain how I came to be very strong on the pedo-ortho business model. And I was intentional when I said my portfolio of practices because I do look at them that way. Just like you should have a portfolio financially, and just like it should be diversified, I look at these as a diversified portfolio of practices. One of the offices participates in no insurance. A couple of them participate in some PPO, and some of them take state plans, Medicaid. And each has its advantages and disadvantages. A no insurance practice is going to have great profit margins, but it's also going to be most susceptible to the market environment, specifically, say, during a recession. Whereas a Medicaid practice has to be higher volume, but it's also going to be recession-proof. So each has, like I said, advantages and disadvantages. And I have the AAO to thank for getting me actively involved in mentorship. They had a mentor-mentee program, and I got involved pretty much when it came out. And then it was shut down for a little bit, and they came back kind of rebranded, calling AAO Mentor Connections. And I'm going to share with you how to get involved with that. It's a free service, and I think it's a wonderful service that you should take advantage of. Because I enjoyed working with young orthodontists so much through the mentor-mentee program, I decided after 30 years of private practice to get back into academia. So I am an attending at the Albert Einstein Department of Orthodontics in Philadelphia, Pennsylvania. It was the first accredited hospital-based program in the country. And this September, it's going to be celebrating its 60th year. and I enjoy that relationship working with the residents. And because I got back into academia, I thought it would be important that I become board certified to be more relevant to the residents. I went my entire career, I was not board certified. My mentors were not board certified. The chairman of my ortho residency was not. The individual I bought my first practice from was not. When I was in residency or when I graduated, there was maybe 20% of the profession that was board certified. And now it's well over 50%, which I think is wonderful. So I took the new scenario-based exam. I took the older version because I took it November 2019, pre-COVID, so I did fly out to St. Louis, 6 rooms, 18 minutes a room. It was an interesting experience, and I'm proud to say that I did pass, and I certainly encourage getting board certified. This slide is also my full disclosure slide, because on my website, orthodontist.com, I do provide mentoring and career coaching services. And by definition, they're pretty much exact the same, but typically a mentor is not charging for their services, where a career coach is going to charge. And I do provide mentoring at no charge for residents. So this topic is an interesting topic that we're going to get into in a moment. But when I talk about those practices that I share with you, it doesn't happen in a vacuum. We have a wonderful team that we rely on to get through the day. It's very important to have a great staff. And I also have a great team of doctors that I get to work with every day and appreciate them so much. This is Dr. Brian Ruda, Dr. Sarah Pavlo. These are partners of mine. Our newest associate, Dr. Noor Tarazi, obviously is expecting in 2 months, maybe really more like a month, and they're expecting their first baby. And then my partner, Dr. Erin Bowerly. And actually getting through their names just now was probably the hardest part of this lecture because I freeze up on introductions. So I'm actually happy I got through that part. So one of the nice things about this topic, you don't go to school to become a mentor. You're a mentor because you have knowledge and experience that you want to share with somebody typically younger than you who's interested in learning from your knowledge and experience. And from that knowledge and experience comes opinions, the opinions of the mentor. And so most of what I'm going to talk about today is IMHO, in my humble opinion. And I may say things that you completely agree with, and I may say things that you have a different experience with, and that's fine. And if you want to share some stuff with me afterwards, I'm happy to do that with you. So a lot of what we're going to talk about today is based on my experiences. And I was asked, am I going to be nervous speaking in front of a group of peers? And I actually felt I was more honored than nervous. This lecture has never been given before. I wrote this lecture specifically for this meeting. I'm not on a lecture circuit. I'm not a professional speaker by any means. But it doesn't mean I don't have experience speaking. So here's me in front of a room of 300 people. They just happen to be 6th graders. And this is something that I've been doing for the last 25 plus years. It is a wonderful internal marketing / community service event. Now, I am wearing a mask, I don't know if you can see from back there. This was my first time allowed back into the schools post-COVID. So I'm in a mask, the kids are in a mask, and the lecture topic is the benefits of oral hygiene, why we do what we do, talk about the hazards of tobacco use. I added vaping over the years. And at the end of the lecture, if you can see in these boxes here by the stage, every kid leaves with a little bag with our office information on the front, new toothbrush, toothpaste, floss. There's a brochure made up by the AAO, talks about the benefits of early orthodontic intervention. So every year, around 1,500 kids, all of orthodontic age, typically between the ages of 10 or 9 to 12, I would say, all about 20 minutes drive from the office, are all being introduced to our practice through this community service event. It's outside the scope of today's lecture, but if anybody wanted to reach out to find out how to probably get this something like this going in your area, I'm happy to review that with you. For the last 2 years, I've passed on this event to Dr. Pavlo. She's done a wonderful job with it. So the tradition will continue. Just to kind of show that the terms mentor, mentee, or protege are part of our culture, I thought I would start with a little video just to get us started this morning.
I still don't understand this. Abby has a mentor?
Yes, and the mentor advises the protege.
Is there any money involved?
No.
So what's in it for the mentor?
Respect, admiration, prestige.
Would the protege pick up stuff for the mentor?
I suppose if it was on the protege's way to the mentor, they might.
Laundry, dry cleaning?
It's not a valet, it's a protege.
All right.
So hopefully you recognize that from Seinfeld, a great sitcom from the 90s. Introduces a few terms there, and I'm going to be introducing some terms because there are many people in our lives that have an impact on us, hopefully mostly positive. Sometimes it could be negative. But they're different than a mentor, so I want to try to compare and contrast just to really understand how a mentor can be so important and how they are different from other roles other people have in your life. We're going to start with some audience demographics today. I want to get into the history of mentor. I said that everything I know about mentorship, I pretty much learned preparing for this lecture. So I found it interesting where the first term mentor ever showed up in our vernacular. We're going to get into what makes up a good mentor, and just as important, what makes up a good mentee, possibly more important. And as I said, I'm going to get into some comparisons of other roles that people have in our lives and how they're valuable, but not quite a mentor. And we are at an academic setting, so we're going to look at the literature a little bit. We're not going to dive too deeply, but I want to share an informal survey that I did. I posed the question to past mentees, past associates, and current associates, recent grads. What were your biggest challenges transitioning from residency to private practice? So I want to share the results with you and some of my thoughts. And like I said, I'm going to show you how to find a mentor. And it is a free service offered by the AAO. Okay? And if we have question time, we'll do that, or I'll just wait after the meeting. I'm happy to meet with anybody if you have any questions for me. All right, so we're going to see if this works. Looks like it's going to. So if you could just scan the code, if you wouldn't mind. And I'm just curious to see how many of you currently are actively working with a mentor or a career coach. Okay, that's wonderful. Okay. So interesting. Interesting that the way I worded the question, I don't know exactly if you said no to mentor because you're yes to a career coach. So that will get rethought if we do this again. All right, what are your currently set? Do we have some residents here today? Are you in the practice less than 5 years? Are you in the practice more than 5 years? I'm glad I have some residents here. Very good. So I'll modify my goal. My goals were to help you, motivate you to go out and find a mentor. But if you're currently practicing 5 years or more, and you feel the willingness to share your knowledge and experience, I would like to encourage you to become a mentor, similarly through the AO website. And then where are you practicing right now? Are you in solo practice? Are you in a group practice but just orthodontists? Are you in a multi-specialist practice, or are you working for corporate dentistry? Okay, we have a nice little mix. All right, so I'll be speaking to everybody. So where does this word mentor come from? So I found out that the first time mentor is ever showing up in the literature is in Homer's epic poem, The Odyssey. Now, I can tell you that I never read the Odyssey or the Iliad. I certainly heard of them. And this mentor was a character that was a friend of the king Odysseus. King Odysseus was the king of Ithaca, this mythical isle of Greece. And he was king of Ithaca, and this is the king that went off to fight the 10-year Trojan War. Because he was leaving to fight the war, he was leaving behind his young son, Telemachus, and he wanted to make sure someone was going to be there to bring Telemachus up in the world, first as from a boy to a man to a soldier, and ultimately grooming to be a king. And so apparently, the god Athena here, who is known as the god of wisdom, also the god of war, she was not happy with this person mentor doing their job properly. So as the story goes, Athena comes down from the heavens, takes the form of mentor, and it's this mythical representation of mentor that did set the foundation for the concept of mentoring as a trusted guide, advisor, and teacher. We know that Socrates was a mentor to Plato, who was also a mentor to Aristotle. These are considered some of the greatest philosophers, writers, and scientists of our time. And they remind us that the path of wisdom involves acknowledging what we don't know, nurturing a curious spirit, and guiding us and others toward their own enlightenment. And a famous quote from Socrates says, "I cannot teach anybody anything, I can only make them think." And that really led to the Socratic method of learning, which is different than the didactic method of learning. The didactic method of learning, pretty much we've all had that. That's where we're spoon-fed information and then we regurgitate it on some test or exam. The Socratic method of learning is where, through a series of questions, you learn holes in your knowledge, and then your job is to go out and find the answers to fill those holes. When I work with the residents, I do try to do as much as I can the Socratic method of learning. I do feel that if you find the answer on your own, you're more likely to retain it. But there's certainly plenty of spoon feeding that goes on as well. But these are some of the greatest mentors in our history. So let's talk about what makes a good mentor. So you certainly hope it goes without saying that they're a trusted individual. They have experience in the area that you are seeking guidance, and that's the key, okay? That's the match, and that takes a little work. We're going to talk about that. Their focus is on the mentee's personal and professional development, and this one statement probably differentiates it from all the other roles we're going to talk about, because it's not highly focused, it's broad. Personal side and professional side, and it's at this level. It's not the mentor speaking down to the mentee. It needs to be this level. And it's informal and collaborative. Informal meaning there's no set time, there's no set place, there's no set duration. It could be short, it could be years. And it really depends on the two individuals and how long they want to take the relationship. And it's the collaborative part that for me is the most meaningful, because you're getting just as much as being a mentor as working with the mentee. And that's really what I've enjoyed the most in all my mentor-mentee relationships. The mentor is in your corner. They're looking for your best interest and your best possible outcome. They're there for you. That's their focus, the mentee, nothing else. And that's a unique differentiator. They provide a perspective that you may or may not have considered when making a decision or carrying out a task of importance to you. They're going to give you the other side of the coin. They're going to play devil's advocate, and you need to be open to it. Because you're making a decision, you need to hear all sides. They're going to cover your blind side. That's the goal. I think a term that is used way too often, and you have all heard it, it's not an unknown term, everything seems to be a game changer these days. And when I hear the term game changer, immediately the hairs on the back of my neck go up. I'm immediately skeptical, doubtful, and now you have a lot to prove. And that's based on my experiences over time. And I'm not saying we haven't had game changers in our profession, because we have. Even before my time, going from full banded orthodontics to bonding brackets, I think that was a game changer. The introduction of nickel titanium wires, that was a game changer. Clear aligner therapy, game changer. Digital records, I do believe these are all game changers. Self-ligating brackets, in my humble opinion, no, I don't see that as a game changer. I think it was a game changer to the bracket manufacturers. It was a financial windfall for them, because they went from selling a bracket for maybe $2 a piece to anywhere from $10 to $15 a piece. So for them, it was a game changer. But for our profession, in terms of efficiency of treatment mechanics, in my humble opinion, it is not. And when you're doing this as long as I've done it, and others as well, you're going to have some bad experiences. I invested in a device, I'm not going to mention the name, and it claimed to move teeth faster with the same great results. So isn't that the holy grail? Move teeth faster, same results. And it worked by vibrating the teeth, and it had all these claims. And I love the fact that I didn't have to drill into bone to make the teeth faster. I didn't have to slice and dice the gums, so it was non-invasive. So I bought a bunch of units, and for the patients willing to buy one to get done faster, they would buy one. And then eventually, the prospective randomized clinical trials came out and didn't support all the hype, to the point that I didn't feel in good conscience I could continue selling those units. And we went back to the manufacturer. Well, they weren't buying them back, so we got stuck with them. So again, anybody practicing for as long as I have is going to have these experiences, and these are the kind of things, working with a mentee, maybe do as I say instead of what I did, can help avoid what could be sometimes a costly issue. And the scope of the guidance is really determined by the experience of the mentor, meaning it is not reasonable to think that one mentor is going to handle all of your needs. And it's very acceptable as a mentor for a mentee to say, you know, I need to maybe find somebody else. And it really actually should come from the mentor. So in other words, if you're looking for, you know, how to set up the orthopedo model, I'm probably a good person to talk about that with. Negotiating an employment agreement, you know, I've done many of those. Work-life balance. I've worked golf into my work schedule for the 25 plus years. So I have some say in that. But if you want to know the best way to integrate social media to market your practice, to bring in more patients, I'm going to suggest finding another mentor, because that's not my wheelhouse. Now, do we have a Facebook page and Instagram in the office? Oh, we definitely do. Am I in the photos? Of course. Did I have anything to do with posting them or how it gets worked out? No. No, that's not my area. So having more than one mentor should be the rule instead of this exception. Let's talk about some people in our lives that are important. I mean, teachers. I mean, we're all here because of great teachers. I mean, we've had some bad teachers too, but hopefully more great than bad. So they're very valuable. And I'm not saying a teacher can't become a mentor. They can cross the line where they get to know you on a personal level and they follow you beyond that course that you had them for. But typically, a teacher is just focusing on imparting knowledge, and they're usually here and you're here, where I said, again, the mentor-mentee relationship is this way. It's a more formal, structured relationship with typically a defined term. You have them for the year, for the quarter, the semester, where, again, a mentorship has no end point. Counselors are valuable people. They're there for our mental well-being, okay? They're typically licensed. They also, though, have typically a defined term. Important in our lives, absolutely, but not a mentor. An advisor. We've had advisors. They advise us. It's typically a targeted advice, which means it's formal. You're going to meet with them at a certain time to meet with the advisor. And whatever they're helping you with, it's usually over, which means it's more defined term. Very goal-oriented. When we start talking about a supervisor, we're kind of getting now into the work world. And if you're going to work in a small practice, there probably no one has that title, supervisor. It's usually the more senior doctor is there to help you integrate into the practice. But if you get into a corporate situation, there's probably a supervisor, maybe they're just called a manager, but they're there for your job performance, and they're there to communicate the organizational needs of that corporation. And if you have a good supervisor, it could be a very nice integration. And if you don't, it could be a real difficult time for you. And in fact, having a mentor to help you get through that difficult time can be quite beneficial, both professionally and emotionally. Role models. How can they be bad? They're your role model, right? But typically, it's not somebody you have direct interaction with. So role models are great. They're important. But it's not going to be somebody typically who knows you and whose focus is you. All right? A role model's not going to have you as their focus, but they're going to be an inspirational figure and valuable in our society. When I use the term influencer, for me, that kind of connotates, you know, a broadcast-based situation, social media, and it's a very commonly used term now. I don't know that we use the word influencer. When I got out of practice, they're typically cultural trendsetters, product promoters. I mean, when I got out in practice, I would go to meetings, even when I was in residency, you'd go, and there would be an expert lecturing. And nowadays, it's typically an expert with a conflict of interest. And the AAO has been really, really good about making sure, and I'm sure you noticed this, pretty much all your lectures, there was a disclosure about if there's a conflict of interest. And I don't have a problem with the conflict of interest. We're so commercialized today, it's almost hard not to. Where I have a bias, and again, this is my own personal bias, is when I see the same person, the same doctor, let's say, kind of jumping onto that next bandwagon of the next great thing, that particular person kind of loses their influence on me. I start to become a little more skeptical. And I'm not saying that they're not valid. It's just a personal bias when I see the same person jumping on the next great shiny object that's being promoted to the profession. And then a consultant. I mean, you hire consultants when you're in practice. You can't be an expert at everything. And again, I have a bias with consultants. I haven't really used them much in my career, but I have used a consultant. We had a situation where we changed our practice management software. We went to the cloud, and even though it was the same company, it needed training. We had the whole staff trained again. And the trainer came to me and said, your business staff isn't using the software to its fullest potential. And I knew that I was not going to be the person to get them to their fullest potential. And so I hired a consultant. So a consultant's going to focus on a specific problem, meaning teach my business staff how to properly use that portion of the software to its fullest capabilities. And it's a very project-specific situation. And that's where the asterisk is. I have two advice I want to give about consultants. Number one, I believe just like with a mentor, one consultant can't handle everything. But what can happen is they come into your office, you hired them because you want to make your schedule more efficient. And now they're in your office, they're meeting your staff, and they hear the rumblings that the practice could really use a better marketing plan. And this consultant now offers the doctor, hey, I can help you with the marketing. But that consultant's niche was on scheduling. So my advice would be thank them, and if there really is a need, go find that consultant who has that niche in marketing, as opposed to trying to continue with that same consultant who's maybe extending themselves beyond their strengths. And the second is, when you are done with a consultant, try to have them leave your practice and your staff independent, as opposed to dependent. Dependent means you're never done having them help you. And in that situation, they may as well be on your payroll because you're never done getting billed from them. So try to make that as a goal, that when they're done, not that you can't touch bases with them, but basically you and your staff are independent moving forward. And then now we have this. This did not exist, just to age myself, when I got out of practice. When I got out of practice, if you were a sole practitioner like I was, you could truly feel like you were on an island. Okay? There wasn't instant communication like you have today. And you have so many sources of instant communication. LinkedIn, X, Facebook, Instagram, TikTok, for now, we'll see. And YouTube. I mean, if I need to do a project at my house, I go on YouTube. Oh, I can do that, and I do. We work with our hands, right? We can do stuff. But every so often, I'll watch the YouTube video, and there's like, no way I'm going to do that. I'm going to hire somebody. But the information is at your fingertips. And then besides all these apps, you've got Orthopreneurs, you've got OrthoTown. I don't have OrthoPearls up there. That's another one. You've got webinar, blog, podcast. There's so many places to get information. You could say, why do I even need a mentor? I have this at my fingertips. The problem is, I think, first of all, it can be information overload. And you can really get paralysis by analysis. And my feeling, in my humble opinion, is the individuals, unless maybe you're direct messaging a specific friend, but in general, the individuals putting out this content, their focus isn't on you. Their focus is on them, to get their message out, to influence you to whatever they're trying to promote. So again, a mentor is there for you, what's in your best interest. And a mentor can take all that noise coming at you so fast and maybe dampen it down to usable information so that you can move forward with whatever it is you're trying to do for yourself or both personally and professionally. I said earlier that the qualities of a mentee is really just as important, if not more, because they have to be proactive. This only works one way, and that is the mentee seeking out the mentor. It doesn't work the other way. So if you want a mentor, you've got some work to do. You've got to do some research. You have to know what your needs are, and then you have to research to find out who has that knowledge and experience in those needs. So you have to be committed. You need to be willing to learn, excited about the process, and open-minded. And remember, the mentor is there to challenge you sometimes, to get you to see the other side of an issue. Maybe put the brakes on a little bit because you're so gung-ho, you're going in this direction. In the end of the day, though, it's not the mentor's decision to make, it's the mentee's. The mentor is there to give you the information, to be your support system, to be your sounding board. At the end of the day, the mentee makes the decision. And the more communicative a mentee can be, the better that relationship with the mentor is going to be. And most important, the last thing on the list, the more self-aware and reflective that you are, the better the relationship is. The more you know your strengths, your weaknesses, and what makes you feel insecure, and the more you can communicate that in a trusted relationship where you know it's confidential, and it doesn't happen overnight. That relationship takes some time to build. But when you have that relationship, someone that you trust looking out for you, who knows what you're going through because they were there at one time, at least from my experience, it's a wonderful relationship. So this is the way it goes. At one time, this model kind of only went one direction, the dark arrows. But it really is both ways, same level, each one learning from the other. I looked into the literature, and there really was nothing in dentistry with regards to research and mentorship. Until I did come across this article by Dr. Amisha Singh, and she's a general dentist in the Colorado area, University of Colorado, and I actually reached out to her to mention that I was going to comment on her article. She was actually very excited to hear that. And I thought she wrote a fabulous article. It's in Dental Economics 2020. I have the link. And really, her conclusions fall right in line with everything I was learning when I was doing my preparation for this lecture. So I'm going to kind of go through. It's kind of a review of what I've been saying, because she really hit it on the job. But all the studies I saw were showing the same things. Having a mentor in your life improves job satisfaction, quality of leadership, efficacy of protocols, and even healthcare outcomes. But it's the mentor's knowledge and experience that needs to align with the mentees. And again, that requires research on the part of the mentee. And again, one mentor really is not enough. There's too many avenues, and really, again, why am I not strong in social media? I mean, it kind of came after my time. But there's plenty of orthodontists who are using it very effectively and could be wonderful mentors in that particular area. Again, onus is on the mentee to make the relationship. And this one I'm going to go over because I think it's a great summary. Having a seasoned practitioner who knows your values, understands your goals, and serves as a sounding board during times of pivotal decisions is crucial. It can add an element of intention to your career that will result in faster development and greater satisfaction. Everything's at a very fast pace, and I think internet has a lot to do with that. I mean, information just comes so quick. Development is coming at us so fast, and having that person, that sounding board, I think, can give you a step ahead, and kind of try help you stay on the right path in both your personal and professional development. We're not going to get into these. These are a bunch of articles that I found with regards to research in the field of mentorship in healthcare. So these are all within the last 10 years, also showing the positive impact mentoring has on individual growth, professional development, institutional performance, and overall well-being within the healthcare sector. So I'd like to get into this survey. So again, I posed the question, what are your biggest challenges transitioning from residency to private practice? So you'll see how well they resonate with you. On-the-spot diagnosis and treatment planning, and doing it with confidence. So we all know that when we come out of residency, we don't have it all yet. And in fact, when I was in residency, and I think it still holds today, the saying was, you need to be in practice for a good 5 years before you really know what you're doing. And so there's that residency to the first 5 years where it can be very awkward. So having somebody who you can talk to and talk through this with to reduce the anxiety that comes with feeling insecure in your knowledge can be a huge boost, both to your professional career, but also your emotional well-being. And that's what you're going to get from a mentor. Because at the end of the day, what are you worried about? You're worried about missing something. You're worried about inappropriate care. And so we have all been through this insecurity. And again, having somebody who knows that and knows you at this point because you've gotten to know each other is invaluable. Significantly more patients seen per day and providing meaningful care per visit, meaning they're just not coming in and you're changing ties and sending them off. So what's a busy day in residency? I mean, 10 patients a day, 15 maybe. And you get out in private practice, I mean, you're seeing that in the first hour, possibly more. So there's definitely a ramp-up period that takes place once you leave residency. And everyone can do it at their own pace, but there are tips and tricks to help you feel more prepared and able to deliver meaningful care, and that's something a mentor can help you with. Taking over a case from another orthodontist and are learning new treatment protocols used in that practice. Well, so that's not foreign to you in residency, because when you get to residency, you have cases transferred to you from the graduating residents. But some of the differences are typically the graduating resident is there for a little bit of the transition, so you can learn about the case through their eyes first. There's other residents that aren't graduating yet, and so typically they know about your case, most likely, because of the interaction with each other, and so they can be there to help you. And then there's the attending. I mean, that's the constant factor. You still have that attending there who's been there from the beginning. Then you get out into private practice, and you could be the third orthodontist that this patient is seeing in 3 years. And the previous orthodontist may have left on a Friday, and you started on a Monday, and there was no overlap. And that can be daunting. And that can be stressful. And so there are things to do to try to ease the frustration and anxiety that comes with that. And again, a mentor can be really helpful, knowing that you have someone you can talk to about that who understands what you're going through. Learning how to work with and manage staff. So that could be an hour topic, honestly. Because that's huge. Because if you have a staff that's working well together and working well with you, it's probably going to be a really good day. And if you have a staff that isn't working well together or with you and there's a dysfunction going on, that can raise a stress level that is, can result in actually burnout, which was discussed in the previous lecture. So you have to understand that human nature in general and staff definitely, they resist change, okay? They don't like change. And when you come in as the new orthodontist, your entire aura is change, okay? And if you think that your degree from dental school and your certificate in orthodontics is going to automatically have you accepted by the staff, then you're going to be really surprised in a bad way, okay? Because it doesn't. You have to ingratiate yourself with that staff. And if you are the kind of doctor who's kind of sitting in the office, on your phone, waiting to be called out to the clinic by the staff, and you wait, you don't get quite out there because you're finishing up whatever's so important on your phone, you're really not going to ingratiate yourself with that staff. But if you're acknowledging the fact that maybe you're short-staffed that day and you're out in that clinic and you're helping turn over chairs and you're working by yourself as need be because you're trying to get that staff done on time, well, all of a sudden now they're looking at you in another eyes, because getting staff out on time is huge, okay? And there's going to be times when you're working with staff and they're going to say something or handle a procedure in a way that isn't quite to your liking, and that's going to happen. And you can't let that build up and then hit them with it all at once 3 weeks later, because it's not going to be well received. In fact, they're going to shut down, and you're not going to get the reaction that you need to get from that staff. It needs to be handled that day for it to be meaningful. But it also needs to be done in a way that's not in earshot of other staff or patients and parents. Because if you embarrass, or if they feel they've been embarrassed, then you have a big hill to climb to get back into a proper relationship with them. So I think you need to have that conversation, and it can be uncomfortable, but it needs to be done professionally. There should be no personal part about it. They shouldn't feel that it's a professional or personal attack, is what I meant to say. It needs to be done professionally and encouraged that you're just doing this for the betterment of them and their career and the betterment of the office. And the last point I'll make on this is there is a difference between being friendly and being friends. You absolutely should be friendly with your staff, absolutely. But being friends can be a recipe for a problem, because you're not going to be friends with all of them. You're going to be friends with a little subset. And all of a sudden, you've got staff that are friends, and you've got staff that are staff, employees. And that creates a dynamic that usually creates a dysfunction and a problem. And you never want to be part of the problem. You always want to be part of the solution. And if you're becoming friends with a few of the staff members, and that is perceived by other staff members who think maybe it's inappropriate, well, I probably would agree, it probably is inappropriate. So maintain a friendly relationship with the staff, but you got to keep boundaries. Really, really important. Learning a new practice management software. Well, I mean, you guys know how to do that. I don't know that, you know, it takes a little bit, but you're going to learn. If I have an issue, it's this with practice management software. If you're fortunate enough to work with a true orthodontic practice, most likely you have a true orthodontic practice management software, which we do in one office in Collegeville. And so when we open up the chart, we've got the patient treatment card right in front of us. We also have the diagnosis and treatment plan right in front of us every time we open the chart, because we all know you don't know that case any better than the day you worked it up, the day you made your diagnosis and treatment plan. And that's the day you realize you got to keep an eye on that upper 7 because it may be getting impacted by the 8. You want to make sure you address it during treatment. Or maybe this patient's roots were a little short, so you may want to take x-rays a little bit more frequently than usual so that we're not running into root resorption problems. And that's going to be in your diagnosis and treatment plan. And if that's not in front of you every time you open that chart, there is a greater chance that you're going to risk something. And so if you work in a practice that was not started by orthodontists, that practice management software most likely does not have a box right there every time you open the treatment card. But that doesn't mean there aren't tips and tricks to try to make it at least just one click away, so it's not buried and you're constantly trying to look for it. Again, to try to avoid missing things so you can get the treatment done on time and you're not backtracking and trying then to explain yourself. So a mentor who has experience in this area is going to understand that and work with you to try to make sure that you're working with a computer system that will minimize the risk for error. So I said to you that I was going to show you how to find a mentor. And it's available right now, and there's no cost. If you go to the AO website and you click on the Careers tab, this comes up, and you click on Mentoring, powered by AO Connections. And when you click on that, you get this. And so if you've signed up, then you can sign in. You can't just hit this if you haven't signed in. It doesn't work. So once you've signed up, you can go in there, and I'd like it to say select a mentor. It says select an advisor. I don't have anything to do with the website. But you can go in, and you can do your research. Because what happens is you'll see the whole list of mentors, and there's a good-sized list, where if you click on their tab, then you'll get their whole bio. So that's you understanding where you need help, where you need guidance, and doing your research to find who has the knowledge and experience that matches your needs. You schedule an appointment, so if someone schedules, it comes to the inbox. So-and-so has scheduled a mentoring session with you at a certain date and time. And if it works, great, or you can go back and forth. And then through the website, you have a Zoom call, video conference. Typically what I have done is if it seems like the mentee wants to continue further in a relationship, we will typically we'll give each other our contact information so that we can kind of work outside the system. It's just easier because they kind of give you 6 tokens. And so I don't want to use up other tokens, so you have other mentors you can reach out to. So it's a wonderful service. It's free. And I would like to think that you could take advantage of it. I'd like to do a little sharing just to wrap things up and tie together this lecture with you guys. How mentors have had an impact on my career. So I was at Temple University for dental school, and I had made it known to the chairman that I was most likely going to be applying to the program. And I had worked hard at Temple. I was, top of the class. And I went to speak to him, and his comment was, Adam, don't put all your eggs in one basket. So the message was very clear to me, even though it's not an uncommon expression. And for me, that meant don't just expect that you're going to be accepted into this program. So you better apply to other programs. So I did. And even though I did get accepted at Temple, I also got accepted to UMDNJ, now Rutgers, and I chose to go to UMDNJ. Part of it was because it was less costly than Temple, and I made a lot of decisions based on that kind of information. So I go to UMDNJ, and all of our faculty at UMDNJ were in private practice, which is one of the things I liked about the program. So everybody had teaching responsibilities, and then they were in some office. And we were encouraged to go visit our faculty's offices. So I went to the office of my chairman, and he worked out of a pediatric dental practice, and I had never even thought about that before. And he was busy as can be, busy as can be. And so it was always kind of in the back of my mind, that ortho-pedo model. It was working really well for him. At the time, most orthodontists were in solo practice, or maybe they had a partner. So it was a little different at the time. And while I was at UMDNJ, one of my other faculty, one of the attendings, talking with him, he had like 4 practices kind of all over the place, and each practice was open a couple days a month. It made no sense to have all that overhead and only be open a few days a month. And I said, well, why do you do that? And his answer was one word. He said, fear. Fear made him do that. Why? He wanted to kind of stake his claim to different geographic locations, hoping that if he was there, no other orthodontist would come into the area. Certainly I get how fear motivates people. None of our offices are open a few days a month. They're all open weekly, one even 5 days a week. So I never did believe in a few days a month, but it had an impact on me, as I'll get to in a moment. So I buy my practice right out of the residency from Dr. Anthony Moreski, and he's a wonderful orthodontist, and there was a transition period. And what I learned from him is, what does it take to run a practice? Because running a practice is not the same as working a practice. You learn how to work a practice in residency. Work up the patient, get your records, come up with your diagnosis, treatment plan, execute the treatment plan. Running a practice is, did you make payroll that week? How are you doing with your vendors? Are you being charged properly? Are you being overcharged? How are you doing with your staff? What's their mental well-being that week? There are so many hats that you wear as an owner. You get no experience about that in residency. And so I cherish the fact that I had that opportunity with him. And then I come out of residency, and there's a recession going on, 1990. And I had just invested a significant amount of money in myself, and there's a recession going on. And I'm in touch with my mentor, chairman, who went working out of the pedo practice, and he couldn't be busier, completely unaffected. And so that's the evolution of how now all of my offices are an ortho-pedo model. Also, a couple of years into residency, there's an orthodontist down in Florida who starts a company called Orthodontic Centers of America, corporate dentistry. It was new at the time. That sounds pretty familiar now. Well, his model seems so successful, and he's moving up the coast, acquiring practice. All these copycat companies came out trying to do the things. It's like, is this our future? Are we going corporate? This is in the early 90s. And so all of a sudden, I'm in this office that I bought, this single office in King of Prussia, Pennsylvania, and I'm thinking, wow, I have all my eggs in one basket. And I started to have fear. And because of that, I opened my next office in Collegeville, Pennsylvania. And it was a tremendous business move in retrospect. But at the time, I was motivated by earlier influences, by previous mentors. And so I will share with you that OCA, Orthodontic Centers of America, it ultimately imploded. And when it imploded, all the other copycats imploded. And all the doctors who had sold to them had to buy their practices back. There were legal issues. I kind of watched from afar because I wasn't part of it. So do I think that that's going to happen in the current environment? And so my feeling is no. It's a different beast now. a different focus. There's just too much venture capital money into what's going on with corporate dentistry. I do think there will be consolidation over time, but I do feel it's here to stay. And I do applaud the fact that most of these corporate entities try to have a mentorship program. And I think it's wonderful. My concern would be this. Again, that mentor-mentee relationship is very personal, confidential. And I feel that you're going to be less honest with a mentor who is part of the company you're working for. Sure, you'll talk about, class 2 mechanics, how you're going to get this case handled a little bit better, maybe how to handle a parent, but you're not necessarily going to share what makes you insecure, what's providing frustration for you, out of some kind of fear that maybe it'll come back to bite you and affect your advancement within that company. And it's the stuff that you're holding back is more likely the stuff that's going to be the reason why you leave. So I do think that there's value in having outside mentorship. And I hope I've achieved my goal today, which is to give you the many reasons why I think a mentor in your life can help both professionally and personally, and to try to make sure you go out there and find one. I want to thank you guys for your attention. Last day of the meeting, so I wish you well on your travels home, however you get there. Thanks, everybody.